Bring up the agenda. Okay, is it showing the record on your end?
Yeah.
Okay,
Yes.
you're good. I don't know. Oh, it is. I see it now on the little dot for crying out loud on the little menu bar.
You've been doing this for how long?
Well, you know, hey, live and learn. All right, so we'll call the meeting to order, whatever time it is here. 11 something. We always send out the minutes before, and you know they're all in this agenda under old business. There's a video on the officer page, and the financial report has been mailed to all board members. So unless anybody, well, I suppose we should do the financial report, but the minutes, we have the minutes, you have the minutes from 5/14, our last team meeting, and 5/21, which was the meeting where we discussed Benestar to endorse moving forward with Benestar. And both those videos, again, are on our formal website, and the agendas and all of it, the minutes, everything's there. So you could always look there. So could I have a motion to accept the minutes from the last meeting, please?
I make a
Move
motion
that
we accept the minutes from last meeting.
All
A
right,
second.
second, all in favor? Aye.
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 One more.
Aye.
You did
Aye,
twice.
aye.
You did twice. You have to have four.
We have four.
Oh, we did? All right. All right, financial report. I'm going to turn it over to Connie at this point to update you here, and then I'll make some comments afterwards.
Well, I hadn't made any deposits in April or May because I'd only gotten one check in April, and I had very little in PayPal, or I don't know. I may have had some, but I waited to get enough to transfer it all. And so then I got some more in May, some more checks.
Yeah.
And I
Got
just,
mine right, Connie.
yes, I did. I was getting ready to say I deposited them all 2 days ago. When that, John, that I told you,
Yeah.
I deposited them. So it was like the checks, I think, were like $300 and some dollars. I can't remember because I left the
I got it
statement.
down here in the agenda,
Oh.
Connie.
Well, I don't see it.
It's down underneath where it says financial summary, and then I got some comments down there about 23 donations with, and so many were from PayPal, and so many were checks. I had all the numbers, but I guess I
I
didn't.
thought so too, and I don't see it.
Yeah.
But anyways, I had some from there and several from PayPal as well. So they're all deposited now. And although I didn't update the spreadsheet showing that they were deposited because it wouldn't match with what he has now. So I always like to wait till after our meeting because it's going to show it next month.
Right. Yeah. Yeah, and as you see down there where third line down under financial support or report, you'll see 5/31/2020, the end of May. CB Bank and Connie's spreadsheet matched at 7241.33. All right. So, and since then, as she just said, I'm looking at my little notes here. I thought I put this stuff in here. I guess I didn't, but
If they match, they match. That's fine. That's how that spreadsheet works. And the
Yeah.
date we're worried about is like June 31st, I believe. And that's coming up. So
yes. But as she said, we had more donations. We had, just for your information, we had 23 donations in May and June. Some were PayPal. I think it was like mostly PayPal, and then there was 9 checks. I believe it was. Yeah, 14 PayPal and 9 checks. And you see the dollar amount there between PayPal and the checks, the 9 checks. The total was $852.85. So next time we look at the budget, you'll see that much more income. Okay. So, and what we've gotten so far in total donations is 179 donations, which again is our highest year was like 250. We're at 179 donations between all our people on Facebook and our people on our official website. And even though we even lowered our budget because there was been no travel due to COVID and the GE Share Owners meeting was a teleconference. So there was no travel expense or anything else. We will, if they have, depending on the COVID, if they have in the fall, the annual meeting, the retiree reps and GE, that annual meeting, then we will probably have an expense there. Okay, so, and we've had other donations, as you all know, besides these 179 individuals from groups, from RX Health Centers, from GE reimbursements, IUE reimbursements, and many, many people have given multiple donations. That's the other thing that I want everybody to understand. There's some people that have been very good to us and consistently give us donations in big amounts, good amounts. So thank God for that, because we wouldn't have with the money we have right now. All right, so our budget was set at 7,400. We have 7,241. All right, and we got some other expenses coming up this month, like Survey Monkey and other things like that. So, and they're good size investments. By the way, Connie, I just got another bill from Prometheus. We have to keep going until we get the new website activated. So we'll be paying for another quarter for $150. Just so you know.
Okay.
All right, so that's the financial report. Is there any questions? You have the financial spreadsheet in your email. Any questions for Connie on that?
No.
None? Okay, can I have a motion to accept the financial report as read, please?
I move you accept the financial report as read.
All right, seconded? Seconded? All right, all in favor? Aye.
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 All right. All right, old business, as I said, it's just listed here. It's just our records, just like the minutes, just like the videos. This is what we covered in the last meeting in 521. These different things here, Benistar, website provider, GE Share Owners. And we never got to this last part, D, which we will discuss today. Okay, new business. This is what I believe has to happen for us to stay viable, stay in business. We can discuss this. We need to have a benefits advocate. You know, as you all know, Melody left. Brian has said he would be willing to learn that and do that. But Benistar would also be a benefits advocate. If we accept them and go forward with them, they would be a benefits advocate.
What is the function of a benefit advocate?
Well, the benefits
Why is
advocate-
Marshall venturing one?
Yeah.
What?
Okay, right now, the way it is, the way we had it set up, somebody's got, is it my volume too high or?
Yeah, somebody's.
Does anybody hear him break up? Or is it just me?
That's what I'm saying. Do I have my volume too high, maybe? Let me see here if I can get this down a little bit. There. Is that better? No, still feedback from somewhere.
No.
Okay, is that better? There you go. Okay, so benefits advocate, the question Charlie asked is, initially,
I'm here.
I'm sorry? Okay,
I'm experiencing like something. The images are stopping.
yeah. Maybe everybody ought to mute yourself just for now, and we'll see if it's me. If you can mute yourselves. All right, now is there any feedback? Sounds good. Okay, benefits advocate. What that was when Melody was in that position, she had to interact with on behalf of the retirees and dependents, interact with GE or via benefits if there was any problems, issues, concerns. That's got to be me that's causing that feedback. What the heck is going on here? Let me hold on for a second, folks. Let me try that. Is that better? Is that, are you getting anything now?
Seems a little better.
All right. So she'd interact with GE or via benefits on behalf of the retirees. And of course, she was at the benefits meeting, we'd bring up any kind of issues with via benefits or any kind of benefits issues related to not just the health care, but also pensions or anything else, life insurance and other any kind of issues. She had a direct line and directly from GE, which is Dean. And I don't remember the person's name, but she had a direct line to benefits to resolve any issues there also. So that was the benefits advocate. And if it was Benestar, they would advocate the company that they recommended is Blue Cross Blue Shield Anthem, and they would interact or advocate for our retirees and independents that have any kind of issues with Blue Cross or Anthem as far as benefits. They would advocate for coverage or denial or anything like that. They would be the advocate for our retirees and dependents.
Our proposed carrier,
I'm sorry?
Blue Cross Anthem, our proposed carrier, because I just saw some note today that you
Yes,
sent
I just
today
sent it this
about
morning,
Blue
Charlie.
Cross.
I just got it.
Oh, but did you read, was it Blue Cross Blue Anthem that is the plan?
That's the plan they're recommending right now. Yes, and we'll go over that in a minute. So for us to stay viable, I think we need a benefits advocate. We need to grow. We need to sustain the low amount of we can't sustain the low amount of members and low contributions. As I continually say, there's 50 to 60,000 online GE retirees and dependents that we could market. Even if we got 10%, it would be a lot better than what we have right now financially and membership voice with GE. So we need a partner to add value. The one thing you always brought up, Charlie, is we need to have some value to our offer our members, and benefit advocacy and a benefit plan that rivals and beats, in my opinion, via benefits is what we're offering. So we need a partner, and if we approve Benestar, they would be our partner and add a lot of value to what we have to offer our membership. And they'll help us with marketing. They'll help, basically, they will cover all the marketing costs to reach out to that 50, 60,000 and try to really bring in, help us to grow our membership, bring in membership, you know. And without these two, you see how we went over the financials, you see how that, you know, we just barely stay alive, and we have to beg, borrow, and steal and get the people to try. We have to continually send them emails, try to get donations, and our donations have dropped off from a high of 250 to 179. Just barely meeting the budget, and if it wasn't for multiple donations or groups or whatever, we would never make it. So I believe Benestar, benefits advocacy, and healthcare benefit alternatives are our only way to survive. I agree with the statement that we need to have value. I know there's people out there that are saying, why should we pay you guys when we can get it for free on all these other GE Facebook pages? And they're continuing to say that. I know that for a fact.
I need to turn off my video if you can hear me, because your images and your sound is breaking up. I'm getting like 70% of what you're saying. So
Yeah.
video takes up more bandwidth. I'm going to go turn my camera off. That might help them at least. Thanks.
All right. Yeah, I don't know what the problem is today. We usually don't have this problem. I think Betsy had to go out and come back in. Is that better, everybody? Is the sound better now? Yeah, okay. I mean, I've turned the volume way down. I don't think there's a volume. No, now I'm hearing feedback again. I don't know. So any discussion on what I presented right here? You know, I've been saying this for a long time. You know, we're stagnant in our growth. I mean, we've picked up quite a few in Facebook. We haven't picked up a ton in our formal website. Hopefully, when we get a new website and have these benefits to offer again and start marketing that and publicizing that, maybe we will start to grow again. Myself, I get a little tired, to be honest with you. I get a little tired with begging all the time to keep us alive and hearing the negative comments. Any discussion on that from anybody? No?
I think the new website and something of value, true value,
Yeah,
to offer people should get if we're going to gain, that'll do it. If we're not going to gain,
that's right. If we're not going to gain, I don't know that I want to continue to do this, to be honest with you.
so
You know, I just don't feel that we should have to, you know, we provide a service and I think a pretty damn good service, advocating on their behalf and offering plans to them and constantly trying to improve their benefit plans and save their benefit plans. So, you know, I just, you know, you ask them for $25 a year. That's not asking them to cut the right arm off. That's for damn sure. So, yeah, we only have what, 4% out of our total membership they give, if that, 4%, somewhere in there. All right. So let's go to Benistar. Now, we endorse moving forward so we could look at the contract and the tree health plan. So the email I sent you this morning, I'm going to bring it up here in a second, gave us a contract. Well, the contract will be coming next week, early next week, it said in the email. And then the healthcare plans, I'm going to show you that in a second. Now, before I get into those, I want to tell you about our legal review. I talked to the law firm that we used, Nolan and Heller, from when I was up in New York, and they said they don't feel they're qualified to look at a healthcare contract. They helped us with our incorporation, if you remember. They're the ones that reviewed our articles of incorporation, our bylaws, our correspondence with IRS, and our correspondence with the state of Kansas. They were good at that, but they felt they were not qualified to handle healthcare. Now, this company I have right here under number 1, Forrester Bowman, if you look at their website, matter of fact, I think I have it open. Let me see. Right there. Oh, I got to share it, don't I? I got to share that so you can see it. So let's see.
Can you all hear me now?
Yeah, I can hear you, Charlie.
Okay, because there was 10 minutes there I couldn't hear. I wanted to say something, which I forgot in the meantime, but no one could hear me, so it doesn't matter. There's something going wrong with the internet.
All right, it'll probably come back to you. Are you seeing the screen on Forrester Bowman?
Yes.
Okay, this is the section. They do all kinds of healthcare stuff, but this is the section I think pertains to us, lawyer for healthcare provider, medical director contracts. So they do cover every single ad. If you went up and down this page for AHCA, for Affordable Care Act, management services, blah, blah, but the one that pertains to us. So I'd like to talk to them. Once we get the contract, I'd like to talk to them, ask them what their fee is. I hope it's just one fee, one straight fee like we did with Nolan and Heller. which was what, Connie? I think it was about $250. I think that's all it was that time, somewhere in that range. We'll see what these guys are gonna charge us and review that contract, because the one that we definitely want to review from a law firm, a law office. Okay.
What did the last guys do? Did they just give us a price, or did we actually have them read the contract?
The last guys, that was all over the incorporation, Charlie. Nolan Heller handled our incorporation, our articles of incorporation, our bylaws.
And
our,
so they said that they couldn't do this, and they referred these other guys from Florida.
no, I looked them up in Florida. They said they do not handle healthcare contracts. And I said, okay, that's fine.
Florida may be a good choice because you've got a rapidly aging senior population, and there's a lot of business there.
If you look at their website again, they seem very, very experienced. Very experienced. All right. So Charlie suggested reviewing plans and comparing to what we have. We're going to bring those up in a second here, and then we'll after. I don't know that we'll take a vote yet, because you really need a chance to look over this. When you'll see when I bring up the plan, it's very specific. It's long. It covers all Part A, Part B, Part D, in network, out of network, the co-pays, zero deductible. You'll see when I bring it up. All right. So, matter of fact, why don't I just go to that right now? And I'm going to share this and bring up this. Okay. All right. Let me see. Can I zoom this? Let's see. Where's the zoom here?
Or just center it. Yeah.
It is centered, isn't it? It is on my screen.
Yeah, it's centered. It's fine.
Okay.
Yeah.
Let's see if I can make it a little bit better, bigger. There, that a little better to read?
Yes.
Okay, so here's their plan. Let me go up to the top. It just went down on me for some reason. All right. There's a PPO plan, 25P. I'm not sure what 25P means. I think it's the payment down below, but G Retiree Benefit Solutions. Now, it makes three general statements here. The annual deductible, as you see over on the right-hand side, is zero. Combined in and out of network. No annual deductible. You can go to doctors in and out of the network. You don't need a referral, blah, blah. I'm not going to cover every single line in this thing because it's forever. You're going to have to look at it, and you can compare it to what you have. This is the Part A, the inpatient, hospitalization. When it has a little asterisk here, it tells you that whenever there's an asterisk, this little paragraph right here is a qualifying paragraph, all right, about what it covers or doesn't cover. And it tells you the inpatient, what is covered here and what the copay is here. That's a big savings if you've looked at any Medicare plans, zero copay, unless you're in an Advantage. And even then, they have copays. Here's some of the services that are covered inpatient, okay? Again, there's a lot of stuff here. Dialysis, physical therapy, appliances, surgical supplies, blah, blah. Transplants even. It's amazing. Blood services. I hope I didn't go too, yeah, I'm on page 3. Okay. Blood services, physician services. Okay. Now, to be, Connie, you know about this. When you're put in a hospital, you got to make sure that the insurance company is approving it for inpatient or else you get a charge, right? Yeah, she's shaking her head, yes. And they always say, now they tell you, and that's why they have this little qualifier here, if you will, or explanation. All right, you go to the Medicare fact sheet, always ask the hospital, am I inpatient or out? Because if you're outpatient, you're going to be paying copays. See? So you ask the hospital, you ask Medicare, you can read this article. Because if they don't formally admit you and get permission from the insurance company, you're going to end up paying a copay. There's a name for that. Connie, do you know the name for that? You're muted, Connie. So
Yeah, I'm trying to remember what,
there's a name
you
for
need
that.
to ask him if it's Medicare,
Damn it, I can't think of it either myself. There's a name for that when they do that.
Medicare deductible.
What
no,
is it?
no, it's not
Oh,
the
no,
deductible.
there's a name for this kind of thing that they're doing. And it's, damn, it's terrible. I can't think of it. There's a name for it anyway. And
I'll think of it in a
there's been
minute.
many articles written about it. Make sure when you go to the hospital that if you're admitted, one, the insurance approves it. Because otherwise you're going to pay a lot of copays and big copays. So anyway, I wanted you to know.
You need to ask him if they accept Medicare assignment.
That's it. That's it right there.
Because the
They gotta
Medicare
accept Medicare.
assignment takes care of everything, but most doctors and hospitals do accept Medicare.
Yeah.
But if they don't have the assignment, then you will wind up with some copays, unless you're on Plan F.
Unless you're on Plan F,
Right.
which is
And then
going
all,
away, right?
and then it will for some, but it won't for everybody.
Anytime you go to a new doctor and you're a Medicare person, you always want to ask your doctor if they accept Medicare assignment.
Yeah, that's
Okay.
what I'm
Doctor's
saying.
office, that's critically important.
Yeah, it is important, very important.
But here's the thing, a lot of them will tell you, yeah, we accept Medicare, but they don't understand the Medicare assignment part. So you need to ask them to talk to the billing people, to check with the billing people, because we had a big hassle when we were trying to find out if the surgeon that did Ray's open heart surgery, if he accepted the
Also,
assignment.
If they
not.
accept Medicare, they can only overcharge you a certain amount.
Right, exactly. Unless, like I said, you're on Plan
You
F.
also- You have protections along the way.
Yeah, you do, but if you have a choice of going to someone that's got Medicare assignment and one that doesn't, you're
Yes.
saving some money,
Yeah.
especially on surgeons.
So that's just a warning for everybody, let everybody know that, but see, this is something that Benestar would get involved in. If there's any discrepancy or problem or anything like that, they would get involved in it. See? All right, so then you got mental health coverage. You see the copays, boom, inpatient, zeros. Okay. In or out of network. Again, this is a long document, folks. You see the little bar over here. I'm only a little bit here out of 41 pages. Skilled nursing facilities, what's covered? Now you get a little copay going up on extended days. All these services are covered that are listed here. I'm not going to read them all. I'm going to get the whole board is going to have time to look at this and digest this a little bit. And if you want to, if you're going to consider Benestar, compare it to your own plan. Skilled nursing facility. I suppose is that a nursing home? Is that what a skilled nursing facility is?
Yeah.
I would imagine.
Sounds like it, right? Inpatient services that are covered. Okay, a lot of stuff here. There's very comprehensive plan here. All right, home health agency coming to your home. Again, you got an asterisk there, so you got to read this paragraph, which it says, which means leaving home is a major effort. Then they'll approve a home health care service to come in. You can't go out, they'll permit them to go in. I'm sure that's going to be based on a doctor recommendation. Hospice care. There's all your hospice care. There's all the pays. Okay. Columns here. This middle column is in network. The right column is out of network. Okay. Hospice care. So that whole section was hospice care, going from this page to the next page. All right. Now, physician services. These are your Part B. All right, including doctor visits and all that. Now, the copays here are 25. For specialists, I believe it's 25, yeah. Retail health clinic for Medicare covered services, 25. Same in out of network or in. In other words, they're saying you can go to either in or out of network. Obviously, it has to be recommended by your physician, but that's telehealth services, all that's covered under here. They got different rules here and stuff, but you can read all that. More about the telehealth services, telephone, internet, electronic health. Of course, everybody's doing this now, especially with COVID. Everybody's doing it. Non-routine dental care. Okay. Allergy testing, chiropractic services, $20 copay. Podiatry services, $25 copay.
It's all pretty similar to the sample that they sent us like 2 months ago.
Yeah, it is.
So,
Yeah.
you know, maybe I'll give it a glance over because I'm sure it's 50 pages and you're like,
Yeah, there's 41 pages, Scott. Yeah, I just wanted you to see what's in here, all right? And understand the thing. Now, really, you got, like you wanted to do, Charlie, you want to compare apples to apples, and you want to see what your plan offers versus what this plan offers. You have a zero deductible here.
I don't consider this that answer. Because I'm not going to sit there and do the work of comparing 50 to 80 pages of one plan to 50 or 80 pages of another plan.
Okay. Well, what do you?
The proof is in the pudding with their systems and how they view my in-network doctors and the different fees that are charged by hospitals and offices and how everything is integrated. So if I gave them my 2019 prescription benefits and, or not benefits, but prescriptions and pays and what is covered and not and stuff, and
Right.
do the same for Part A and Part B for Medicare
Right.
and insurance company. I've got that data in the works. And I say, here's my data, you know, here's my plan.
Right.
You do the comparison and tell me what my total cost per year is, and I'll believe you or not believe you. But that's my circumstance. And that's like one of 25% of us. If you want to see what it's really going to be, a better sampling would be 4. But I'll need volunteers to help with that.
Yeah.
But
Well, I don't think you're going to take all your different specifics of your plan, and you know, I mean, we have a personal responsibility ourselves to, my opinion, to examine what I have versus what they're offering.
Correct. But we're not just looking out for ourselves. We're looking out for, you know, hundreds, if not thousands of other people.
Yeah.
I think this demands some serious due diligence and not just a quick blessing and let it go through. We're doing this on a sole source basis. This is not a competitive bid. So we're taking risk there. So I don't think we need to take more risk than necessary to speed it up. We've got time. We just need to make sure we're looking at the right stuff.
Mm-hmm.
And I think a one-for-one comparison test where they do the analysis, in my case, in the case of 4 others or 3 others, to get a sampling of the population of our audience, the more the merrier. But that's not going to happen. But if I get
Charlie, are you in like a plan F, G, whatever? Or do you know what plan are you in?
Yeah, it's an F or a G. I can't remember.
Okay.
But some of these things with the copays, I don't have those high copays.
Because you're in a plan F or G. Those
Yeah.
of us that are in a plan N, we have copays.
Yes, I know. But you also have to pay your fees and other things. So the whole idea is to see what these individual people are paying by their own classification. So we can say, hey, is it plan FG compatible? We can say yes or no. Or if it's plan whatever you're in compatible, you can say yes. You know, that's like, I think, due diligence. And I mean, do you know if this one is better than yours at this point?
I'll see if, here's what I'm gonna do, because I mean, individually, I would like them to respond to anybody individually that would like to speak with them, to do, you already gave me your profiles, if you remember, and all your information, but anybody that wants to, I know Charlie wants to, speak with them and do a comparison side by side, that's fine. I'll also ask them to do, I've seen this on Medicare, where they do it on Medicare. They put a chart out, every one of the plans side by side, and kind of, you know, what it covers, what it doesn't cover, what the co-pays or deductibles are. I'll ask them to do a chart like that to compare what we're looking at right now on the screen compared to, I'm not an expert on Medicare, all the different A, B, C, D, E, F, G. I don't even know what's left or what's gone or still there. But ask them to do a comparison chart with those plans so that we can look at that. I think that's the best I can ask them to do. I don't think, you know, again, if you want it individually, I'll push for that. You can do that for an individual comparison. Other than that, I think we need to move forward, you know, and again, we'll get.
Again, John, I've tried to talk with them. I sent them an email on the 21st, and then again later, earlier this week or last week.
Yeah.
And I haven't heard from them. And this was one of the things that we all I thought we agreed to as a good test to do this thing, do this comparison, like I was saying.
Yeah.
They could easily mock us up as if we were.
This illustration that they have, Charlie,
Yeah.
you know, it's kind of vague because it says it's illustrative discussion only.
Right.
And just looking at it, I'll tell you what I'm paying for my medical for my supplement G. It's $117.82 a month,
Yeah.
which for their medical, and it's still Blue Cross Blue Shield. Their medical's quite a bit lower. It's $31.64. The pharmacy, theirs is $191.89.
Yeah.
And mine is $13.20. There's a big discrepancy there, even though one of the medicals is the same as what this one is.
Okay, let me bring that up. With,
Has advantages in one aspect and then doesn't in the other.
Yeah, but again, and that's why I think if you showed them what you actually incurred for medical expenses in 2019, and if they could do it for 2 years, great. If they provided us a format that we could either input it or make sure we had that information, and they could scan our information in and run it through a program and do the analysis and spit it out. They can do the figuring, and I think as someone trying to sell us a car, you know, help them. I'm helping them sell us the car. Show me that it works. This is a test drive.
Well, what we're going to personally do is 41 pages, but I'm going to go ahead and either print it out or we'll have one laptop and we'll scroll down as we do it. But we're going to compare Ray's, because Ray's a perfect one, in my opinion, for us, because of all his health issues and stuff, and how many times we go to the doctor and have blood drawn and stuff like that. We're going to compare this one ourselves with, and then do the math and see which way we're going to save money.
That's a great idea, because you have all that data there, and I'm getting all my data. If you want to disguise certain stuff of your data, do you want to share it with me?
I'll be happy to share it when someone
Regani
with it.
shared it before with us.
Yeah, we're good at doing Excel together, so.
Let me make one comment. I brought up the screen with the payments. When you're looking at the prescription, please remember, with the biggest cost, biggest hurt, 29% of our people is in the prescription area. And what this covers is donut hole, this covers catastrophic, this covers brand name, this covers a lot of different specifics under prescription. I guess what's missing here, what it didn't explain up in that 41-page document or plan, is the pharmacy coverage, but we did cover it before with Benestar. Remember, there's a lot of benefits because a lot of people get a big out-of-pocket expense with pharmacy, with prescription costs, especially if they have other illnesses, comorbidity, and they take a lot of medicines.
That's a make or break for a lot of people.
Here it is.
Get up
And that's why that one's so high versus the medical part.
Yeah, exactly.
When you get into that donut, you get into that catastrophic, brother. And we know from our healthcare surveys, some people had $8,000 out of pocket expense, had diabetes or other major illnesses that they had to cover, whether it's kidney or, anything that they needed expensive brand name medicines, and they paid through the nose, if you remember from our healthcare surveys. So I just wanted to mention that I know it looks like it's high for prescription, but there's a lot more benefits included in that pharmacy.
Right. And we talked about that the last time.
Right. So I just want to clarify that. I know,
But we also have to remember that we can't take, those that are getting the RA can't get both of these plans
that's
through
right.
Benestar, or you're going to lose $1,000. Now, because I expect that GE will eventually wipe out the 1,000 and be done with all of us, then I'll jump on this one for both. But until then, I got to stick with VIA for one. And that'd be my prescription.
After this next contract's done, Connie, I totally agree with you. They're probably going to wipe the whole thing out. They're in such bad financial straits right now, they'll take a dime away from us.
Because they're assholes no matter what.
Well, just tell it how you feel, Connie.
Oh, no, I'm just pretty shy and bashful.
Yeah, you're holding back. You're holding back, Connie.
Yeah.
But I would not trust that either in any way, shape, or form. Oh, my God. I call it the whack-a-mole syndrome, folks. And what I mean by that is every time GE seems to start to get their head above water, asset sales, doing everything, cutting the dividend, doing all these different maneuvers. And then all of a sudden they get hit with something else like COVID. Boom. And COVID affects aviation. COVID affects it helped the healthcare a little bit because they got into the ventilator piece. But they're hurting. They're hurting bad. And I hope they make it. God, we all hope they make it. But if there's anybody they're going to take more away from, it'll be us. It'll be us. Believe me.
Yep.
So, all right. So, once again, I will say that this to Benestar. I will say to Benestar, some people want the comparisons. They provided the profile. They want a comparison. Okay. I'll say that. And now, anybody that wants that can email them. I gave you the information. If you want it again, I'll send it to you again. If they don't respond, let me know. Like Charlie, I will beat up on them. And then I'll ask them to do a comparison of their plan as it stands right now, how it compares to the Medicare.gov plans. Not via benefits, because I think it's a waste of time, to be honest with you. But I'll ask them to do that. Is that satisfactory for everybody?
Well, yeah, let's see the results, and
Yeah.
the results will tell us stuff.
Yeah.
What did they do with all the data that we gave them on our plans? I mean, they must have had some discussion about what we shared. Can we get the results of any of their discussions internally?
Be honest with you, Charlie, I don't know. I gave them all the profiles with all the information, your plans, what you're paying, your date, date of birth, all that stuff. I gave it all to them. I will push on that. I will say, listen, if there's a hesitancy that the board feels we need to have at least to be able to compare for ourselves so that if we're going to be promoting this out to our larger membership, we feel comfortable with it. And how about a comparison chart? We don't expect it to be 90,000 pages, but a comparison chart like they do on Medicare.gov of different plans with your plan, you know, or pick the three most popular from Medicare.gov in your plan. And then we can have a chance to look at that. All right. Does that sound good?
Sounds good.
Yep.
Okay. All right, then that's what we will do. All right, let me go back to the agenda here. Boom. Okay, let me give you the update on GoDaddy. I've met with him twice with a design consultant. Her name is Angela P. They don't give you their last name. They must be afraid or something. I don't know. Discussed the content and the design. I provided them with copies of our current pages. We worked on narrowing our initial build to the first 7 pages. The initial, that's why I put in quote, this is the initial build to get it out, get something going, get it done. Give us something to look at that, you know, we'll look at as a board and say, yeah, that looks pretty good or doesn't look good, or maybe this should be included or that included. I'm going to show you the email with the initial 7 pages. I asked her to, let me see here, I got it here. Go to this, let's see. I believe this is it right here. Okay, home landing page. Obviously, we need a home landing page, right? You got to go in on something. Registration and fundraising combined page. Benefit plans or other member plans. Of course, we got to approve Benestar before that'll be in there, but I'm just putting it in there. Dental and vision plans that we have on our site, RX Help Centers, and the Trav Now. That'll be another page right there, 3rd page. Member news and other member info. That'll be consolidated with my updates, the solution monthly newsletters, announcement events, webinars, resources, and links. Interactive member blog. We're still talking about the definition of this and what it would look like, but it's a way for people to contact us and a way for us to respond. And it can be broken up into healthcare and pensions and Social Security and what am I looking for? Medicare, you know, or other issues. It could be broken up into issues that they can interact with us or even with Benestar being part of that or our board. And we can respond to any issues they bring up. Tools and handouts for meeting, that's going off for now. That got set aside for now. Officer page, which we have to have our officer page. That's where all our legal documents, that's how we interact because we're all in different states. We have to keep that page. It will be private. Many of these, we got to decide once we start looking at this, what pages are we going to keep? Obviously, like when they come in, it's going to be public. When they register, it's going to be public. But when we get to the benefit plans or the member news, is it going to be restricted just to those that pay dues or not pay? You know, we got to make that decision. That's another discussion we've been having for about 2 years.
Well, why don't we make a committee to look at the pros and cons and then make a recommendation with the pros and cons listed? And get that, you know, we come up with the same questions sometimes over and over again.
I know. Well, we've been discussing it only because, you know, after we had, if you remember, we had one general membership meeting there where the person said, well, why do you keep giving it away for free? You're never going to get anybody to give a donation if you keep giving it away.
Well, part of giving it away for free is the fact that we're nonprofit, I would say. And
I'm just talking about when I say that, Charlie, I'm talking about we only ask in a nonprofit for $25 a year contribution to cover our expenses. That's all I'm saying. It's not they're really paying to get the benefit, but they're paying to get on our website to look at those benefits. They got to pay a membership to do that. I don't know, even other nonprofits.
well, you know, other nonprofits you can compare yourself to would be AARP, where you have to be a member too. So
Yeah, exactly.
But
exactly.
just to be, and a lot of people don't like AARP because the stuff that you get, they get kickbacks from
Yes,
the
I do.
United Healthcare or their Medicare Advantage plans, and their eye doctors and dentists, and
Yep.
you even see that in the fine print.
What's
I know.
wrong with just
I'm sorry, go ahead. What happened?
I lost them too.
Rodney, you froze up. If that was Rodney, did he freeze?
Yeah.
He froze
Yeah,
up.
Yeah.
on me.
There's something wrong with Zoom.
Yeah, it's not acting very good today.
That's
Rodney,
why
can-
I turned my video off, because the video has a lot of bandwidth that gets used up. So if you don't need to look at each other falling asleep or cooking,
Yeah. I was just gonna take a nap too. Dan.
having a rum and coke,
Let me, Rodney, can you hear us or did we lose him?
He's frozen. Now he's gone.
Yeah, he's gone.
Video's off. Now his video's back on.
You
again.
there, Rodney?
Yeah, I'm there.
What, did you start to say something?
Yeah, what's wrong with just leaving it just for members for now? See how this plays out for 6 months or so, and if everybody's saying, "Hey, this is great," we can have it like an open viewing for maybe a week to let prospective members look at it or whatnot, and
That's a
see if
good
they're
idea.
interested in joining that way, kind of like a bait them into actually joining.
Yeah, I kind of like that. You know, I think way back when we were trying to decide, one of the things we said was, I just got a message from Stanley. He got busy and missed the time. We said that's what we'll do. We'll leave it open for a while and see, and we'll promote. I really haven't had the time to really promote, you know, put box ads up on our thing, do mail poet, email distribution list, send the things. But with Benestar, if we do approve them coming on, we're going to do a strong marketing campaign to reach out. We're going to do it as many ways as we can, whether it's Facebook ads, but, Facebook, that's an Amber Alert. Facebook ads, Google ads, regional specific ads. I know all the top areas for GE. They did at least provide me with that. They wouldn't give me their emails, but we're going to do a lot of that box ads on the different Facebook pages, all kinds of things, folks. We're going to email distribution. And hopefully we'll bring the people in. And like you said, Rodney, I kind of like the idea. Let them look. We'll say, okay, we're going to leave this open for 3 more months. You have a chance to look at what we have, what we're offering. We strongly encourage you to become a member. If you don't, after this date, these pages will be restricted to members only. How's that sound to everybody?
Sounds good. If we
I
don't
think it
figure out
sounds
some
good.
way to get more money, we're not going to be here. So
That's right. Exactly, Bob. Exactly, which I keep trying to tell everybody. And I'm tired of begging. I don't know about the rest of you. I work a lot on this. You know that, folks.
Well, it really doesn't help. And when you go to some other Facebook groups and you read comments there where you can always get things for free here, it'll always be free. We don't charge you. Well, we don't charge anybody.
I've heard that lately.
Yep.
We don't charge on ours either for any answers or any questions that
Yep.
they have, and we answer it. We're not charging. So it's kind of like leading people the wrong way, like making people think that our Facebook group is charging. It's not. It's the website that we're charging.
Yeah, we're covering
Yeah.
our expenses. You know?
But I mean, obviously, none of us will get on other Facebook groups and say that because, well, it's not my Facebook group. So
Let me ask the board a question. Is there anybody here getting a salary? No. Yeah.
mine got lost in the mail, I guess.
Bob, I sent it last week. You got your $5.
mine
No,
comes
but
like
we're
that.
certainly shelling money out all the time, aren't we?
Yeah, darn right. You know, I mean, doing what we're doing, trying to get, again, add the value, advocacy, the benefit plans, new website. We're going to do a strong marketing thing. I hope we can grow. I really hope. I always, you heard me say this so many times. I was looking for a tipping point that we could grow. And then we haven't got to worry about expenses and all that stuff. Are we going to have those negative people on the other side saying what they say? Yeah, yeah, they are. But you know what? We're offering something of value too here, you know? Of course, well, I'm not going to
Well,
be a
and
negative person.
when you say that, John, when you say that and we want to promote the website, I think it would be beneficial to make mention of that on the post, what we are offering on the website, so
Yeah.
that maybe they will be more convinced to at least go check it out.
Yeah. And I used to put that up every so often on our Facebook page, the benefits of our membership, you know, that
Yeah.
document, and then I shrunk it down into a box ad and all that stuff. We're going to have to do more of that. Absolutely. I mean, that's called marketing. And that's exactly what I'm going to work with if we approve Benestar, I'm going to work with them on that. And all other kinds, like I said, Facebook, Google ads, regional ads, email distribution. We're going to try to hit this thing big and reach out to that 50, 60,000. And then when they see our growth, then maybe they'll say, gee, they must be offering something over there that everybody's coming in. You know? Okay, so that's the update with, let me go back here. I'm going to, with Benestar, or GoDaddy, excuse me. Let's go back to this. So they're starting the initial build right now. They said 10 working days, which means like Monday to Friday. So they'll have something for us to look at, GoDaddy, by June 26th. And then after that, we start the whole refining process with what they call the care team. You know, we want this changed, this doesn't look right, this doesn't sound right, this is wrong, or whatever. My next meeting with the consultant is on June 29th. So by our next team meeting, we'll have something really good. Even before that, when I have remember the link here, because once they do the build and they publish it, even though it's just for us now, I will let you know and you can go look, okay? You can go look at what we got so far and see how they did with it. All right? Sound good?
Sounds good.
All right. So that's GoDaddy, that's Benestar, which we discussed. I will get a hold of them and I will cover the things we talked about. So if anybody else got anything at all?
John, do you know when I have to file taxes? I don't remember.
Oh, thanks for bringing that up, Connie. Darn it. I had that on my pad one time and totally forgot about a number of me. I think it's around July, was it? August?
I was thinking it was around now.
Yeah.
Are
You
you
bet-
I was going to call her in a little bit.
Yeah, you better give her a call and find out because, yeah, we got to do I think it's 990 it's called, right, Connie? The form?
Yeah, I
I
don't know.
With IRS and with state Kansas, we got to file our taxes.
Yeah.
It's really a financial report. I mean, we don't pay taxes. It's a financial report. You got to, as a nonprofit, you have to file it. All right. That's why I always say we got to keep good records, folks, because if they ever want to audit us, and I think we have exceptional records. I think we have very good records.
Mm-hmm.
You know, so okay. Thanks for bringing that up, Connie. Yes, definitely. Please give her a call.
Okay.
Connie works with a tax consultant in Kansas. Every year she's done that. And they do it for us. She brings them all the spreadsheets and all the data and all the stuff they need. And we've been good so far. We haven't been questioned so far, right, Connie?
Right.
I mean, other than $300 I had to get that guy to just get off our back. No, I'm only kidding. All right. All right. So if everybody's happy, is everybody happy?
Yep.
Okay, then. Can I have a motion to adjourn then?
I make motion, we adjourn.
All right. Second it. All in favor? Aye.
Aye.
All right, everybody. Thank you very much.
Thank you, John.
All right.
Bye, everybody.
Bye,
Bye-bye.
everyone.
I'm gonna kill it.
Ah!
Oh, somebody died. Somebody died. All right.
End meeting for all. See y'all.